Hi, a very warm welcome to Dr. Shefaly Shares, and those who know me, they know me, and those who don't. My name is Shefaly and I'm a nursing and midwifery professor from National University of Singapore. Very excited to bring here another video upon request of many of you who wanted to know, you are a midwife, you often talk in your videos. Tell us how a day in a midwife's life look like and what midwives do. Here I am at your request. Midwives. It's if I remember, I think Latin or Greek words which means mid and then wife. It's not that you're a midwife or midway wife of somebody's, but it means that being with the women. Yeah, so that's what we do. We are with the women right from their pregnancy when they give birth and then after childbirth. Midwife, if you ask me, I think it's a beautiful profession because personally I feel it's a happy place because we bring life and joy to people's life. In Singapore especially, if you want to specialize in midwifery, you have to have at least 3 years of clinical experiences working in a maternity unit as a registered nurse, and then you need to go for this specialization. Currently, the specialization is offered by Nanyang Polytechnic, and it's a 9 months. When I took it, it's about 1 year, and now I have heard that it has changed to a 9 months rigorous program. After going through all the theoretical modules, you also go through clinical practices. We learn how to deliver babies, and let me tell you something. We actually are licensed to deliver babies. Really? Yes. However, before we are licensed, if you don't know, let me just share with you. As registered nurses, as you all know, that we are registered with the Singapore Nursing Board. As midwife, we also have another licensure with the Singapore Nursing Board. That means I have now 2 registrations, one as a registered nurse and another one as a registered midwife. In order for me to be registered with Singapore Nursing Board, registered midwife, I need to conduct at least at that time 30 normal vaginal delivery. That means I need to deliver in supervision babies in the world. Normal vaginal delivery, we can't do at risk, we can't handle at risk pregnancies, we can't deliver babies for cesarean sections, we can't deliver babies who need certain artificial equipments, for example forceps delivery or even vacuum. But simple at low risk pregnancies, if they have no other complications, midwives in Singapore can deliver babies. However, there's a little bit of a difference here so that I don't give you a wrong impression. In Singapore, if you want to really have a hands-on and deliver babies, you must be working in a public hospital, and we can deliver patients who are under subsidized care. If you're working in a public hospital and patient is under a private care, then the doctors will be delivering the babies and you will be assisting the doctors. Similarly, those midwives who are working in private hospitals, for example Raffles, Gleneagles, they also do more of a collaborative and assistive role. Having said that, many a times, as you know, babies don't really wait and see the time when they want to be in this world. So sometimes when even a private patient, doctor is on the way and stuck in the jam, and baby has decided to come out and you are a midwife on duty, you will get the honor to deliver this beautiful creation of universe to the world. So that's what we midwives do. Like I said, of course, commonly people think midwives just deliver babies. I just want to little bit burst that myth, because midwives, we are a companion with women right from pregnancy. Because I would say, even when I did midwifery decades ago, people used to think that, there's this thing about postnatal blues or depression which only happen after childbirth. I must say that pregnancy itself, it causes a lot of hormonal, physical, emotional changes in women's body. And as midwives, we journey that pregnancy with women, prepare them, make them educate them and make them aware of what is coming next. Because many a times I feel, especially, and I have personally witnessed that when women are not informed, they get very overwhelmed during childbirth and sometimes even ending up going for cesarean. But if midwives, I feel, have been companion with them in the early days, right from the pregnancy, I feel generally women do very well, and it's a research-based, evidence-based. That's why in Singapore, especially KKH hospital, they have this midwifery-led care, which means even NUH has this midwifery-led care. We used to call it a Emma care, but basically the concept is that midwives, they journey along and companion with the same women who are pregnant throughout their pregnancy, then they are present during their childbirth and they support them at least for a first month or so after the childbirth. So that's one thing to take note. Not just delivering babies, we are supporting women throughout, at least from pregnancy till early postpartum period. We play a very important role in education. We also play a very important role in preparation, especially what is required, what are do's and don'ts during the childbirth. And like I said earlier, we have honor, we are trained, we are skilled to deliver babies and bring them into the world. And some of us even have specialized training, especially after childbirth. If women develop certain sort of a cut down there in the perineum, some of us are trained even to do the suturing of that, but it is not common for all. Sometimes after, even if it's a midwifery delivered baby, and if a mummy has a cut down there, sometimes we have to engage doctors to do that suturing. So there's a bit of a rules on what midwifery looks like, and also how you get that training. Another thing I would say is this is a specialization which is not for the light-hearted. Why I'm saying that? Because though it brings a lot of joy and all that stuff, you may also have certain cases which will change your life for whole life, because you sometimes witness babies who are born late. You have witnessed journeying with the parents who have a very precious baby, probably they are going through, and this is some cases I have seen, they are going through in vitro fertilization, very precious, very special child. They are going through everything, we are with them, and then they had IUD. I'm sorry I'm using a technical terms, it means intrauterine death. For some reasons, baby passed on in the uterus, and then delivering that dead baby. We don't want this mummy to have a cesarean section, because she will have a scar for life who will remind her there was a baby who is never there with her now. So we also journey these things with mothers. So like I said, that it can take a toll on us. But there are some also light-hearted moments, if I can share with you, especially in Singapore context. We are very fortunate that we allow companions, especially fathers, in the delivery suite. And being Asian, I'm married, I know my husband, if you ask him that, how strong you are, yes, I'm very strong. And especially when mummies give birth, it is quite messy. There will be a blood, there will be water bag. I'm trying to make it less jargon here. So there will be this all fluids there. And because baby has been born from uterus to outside, there will be a huge body temperature change, right? Because baby is inside mommy's womb and then coming to the world. And generally we'll switch off the aircon. So it will be warm, humid, and then all those fluids will have a little bit of a smell, if I can say. And then also, if midwife is like me, I will be shouting at the top of my lungs to motivate mommy to deliver the baby. Hey, push, you can do it, and all this. It's a very exciting stuff going on there. And then gently we will ask daddies, we want them to be engaged, we want them to take loads of photos, and even want them to engage in cutting and involved in cutting the baby's umbilical cord. So I'm very excited to do all these things. So I remember always asking daddies, so daddies, are you okay? You can see the blood and all that. Without fail, 100% daddies will say, of course, nothing, that's a small thing. So yes, fine, but I learn with my mistakes which I made. Whenever a daddy, especially who say without thinking, yes, no issues at all, I will always say, okay, Shefaly, foresee a problem. So whenever I have such daddies, I'm going to share with you one or two. In fact, it happened many times, but I vividly remember this daddy, yeah, no problem. But I have learned from my mistakes. So I remember we always have a recliner chair for daddies, because labors can go very long, and mummies can take sometimes a day to deliver the baby into that labor and all that. So we'll always have the chair. I make sure I strategically put that chair so that daddy can have a space to calm down if he needs. So lo and behold, we went through the whole hula boo. Mummy push, 1, 2, 3, no aircon, lot of shouts. Shefaly's inside with the mummy. Mummy is excited, lot of blood, lot of smell, all that going on. And suddenly, yay, baby is delivered. I'm so excited. You can see I'm still excited. So baby is coming out. Mommy is so excited. I'm calling daddy. Daddy, come take photo. Daddy, cut the umbilical cord. Like, where is daddy? Daddy's on the floor. So I think I missed that recliner chair. Daddy couldn't reach the chair. He was stuck on the floor. It's funny, but it was not that funny, because after that, a lot of aftermath, getting the baby, daddy to senses, give him water on the aircon, bring him out and all that stuff. But yeah, that's the fun side of it. And another fun side of it is daddies always love their wives, and all the mummies are all excited to bring this baby to the world. And suddenly, all that love of the daddy who is holding the mummy, kissing and all that stuff, and the baby is out, totally forgot where is the wife. They will just focusing on the babies. Some will cry. That's very beautiful. In fact, I will always sometimes cry with the parents when I see that beautiful baby they are holding. And sometimes you have to remind them, Daddy, take photos, because we don't want them to miss those moments. And also remind them, please spend some time with your wife. So it's a very, very beautiful thing, and I hope you can feel from my energy here. And that's all we all midwives do. So that's during the childbirth, and of course then journeying with them after childbirth, sharing with them, you know, what are the certain milestones baby needs to be achieved, especially be very vigilant on baby developing neonatal jaundice, and also breastfeeding issues, and also especially picking early signs of blues, postpartum blues, and then depression, both for mommy and daddies. So I would probably cover another video probably on postpartum blues and depression. That's one of my research topic, especially on fathers, because we always feel, especially in our Asian context, that fathers are macho and they have to behave very stoic, but they go through a lot of emotional ups and downs. In fact, all men go through. So probably we can cover a little bit on that in another video. But for today, just wanted to cover with you what midwives do, what it takes to become a midwife in Singapore, and generally what are our roles. I hope you find this video useful. If you have any questions, please write on the comments, and please tell me what other videos you would like me to develop. Thank you very much for being with me, journeying with me, and remember, we are here in a safe environment to support each other from one nurse to another. Remember to stay awesome. Thank you.